Welcome to Will and Mark's Healthy Sports Obsession. I'm Will Hubner here with Mark Mashashik. We are two doctors of physical therapy, and we are here to answer your PT questions as well as give our take on current sporting events from a health perspective. As always, send your questions to willandmarkshso@gmail.com, and we will answer them on the show. Hey everyone, welcome to another episode of Will and Mark's Healthy Sports Obsession. I'm Will Hubner here with Mark Mashashik.
We got a big one today, big one.
We got a special guest. You can see him on Facebook Live, Dr. Pannone.
In office today. This is not a regular phone-in guest.
Traveled a long way to come see us and be part of the show.
It's a big deal. Absolutely. He's a big supporter of the podcast from the beginning.
He's a big into dry needling, also referred pain. We'll go through his bio in just a second. We're also going to get into the big news of the weekend, the NBA All-Star Game, the dunk contest disputes, the All-Star Game itself, new formats. We're going to get through XFL. Is anybody watching?
Yes.
And then you want to talk about NFL Combine as well
excited.
today?
It's 7 days away. Start thinking about it. Don't let it fester to the last minute before you think.
But since we got the man of the hour here, Dr. Albert Pannone, let's start with him, shall we?
Yeah. A lot of questions coming in about dry needling, so we just wanted to bring in the right man to get all these questions answered for all you listeners.
And you guys couldn't find the right man, so you settled on me.
Yeah.
Yeah, okay, good.
All right, so Dr. Pannone's been practicing since 2014, went to Chatham University, where he won the Peer Excellence Award at Chatham University, Peer Recognition Award, sorry. Since then, he's completed a APTA credentialed residency program through the Institute of Physical Arts. He has helped develop courses for an OCS residency program. He has two publications, research publications on T4 syndrome, a clinical example of the regional interdependence theory. And he also has one on T4 syndrome, a scoping review, Journal of Manipulative and Physiological Therapeutics, back in 2016. So we are lucky to have Albert here.
Very excited.
So just starting out, can you give us, we obviously just heard a little bit of background about yourself, but kind of what kind of your philosophy is as a physical therapist and kind of what gets you excited to be a PT?
Yeah, absolutely. So I really like, I think my residency through the IPA got me into this, and even before, I really like looking at function and how can I intervene in somebody's day-to-day activities or how they're strengthening and things like that, and change their function and really make sure that they are moving in a way that is both good for their long-term health and good for short-term, whatever they're coming in for, pain or whatever problems they're having. And I like to see more technical, complicated patients. I think something that really gets my brain going. So.
Yeah, that sounds a lot like parroting is some of the stuff that me and Will are interested in, so we're all in the same boat. What brings you in that's a little bit different is tell us, how often are you using dry needling in your practice, and where do you start to see the value of it? When you decided to study dry needling as something that you're becoming an expert in, where did this start, why you do it, and when are you doing it?
So I'd actually never been experienced to it. So when I went to school in Pittsburgh, up in Pennsylvania. And I'm not sure if this is still the case, but at the time, dry needling, you weren't legally allowed to do in Pennsylvania. So I had never been exposed to it. I actually moved down here.
Makes you want to do it more, though, right?
Exactly, yeah. I moved down here. I took a job in Old Town Alexandria, and my boss at the time was the only person at the clinic who did dry needling. And I saw it as a modality. It seemed incredible. He needled someone, their pain just immediately changed. And it was quick, 15, 20-minute treatment, had a big change in his in that patient's symptoms. Got interested in it from there, and then I ended up taking the classes over. You have to take two separate classes over the span of a year, and ended up really liking it. So you'd ask, I use it in my practice, like when and what kind of patients.
Sure, yeah. Go on.
So I tend to find it works really well in kind of two separate group. I guess everything fits into these categories, but two specific groups. If you have someone with an acute, specifically muscular pain, say somebody like pulls a muscle and it's really irritated and inflamed, that acute muscle problem usually responds pretty well to dry needling, as long as it's something safe for you to do. And then the other one is more of a chronic muscular problem. So patients who have postural problems or something where they're kind of chronically overusing one muscle over and over and over again, and that muscle tends to tighten up. That's another place I find using dry needling works really well.
So in either of those cases, going to what we had for a student question, would either of those situations relate to a trigger point, or how does a trigger point relate to those specific two categories?
Yeah. I tend to find trigger points in a couple of different situations. Acute spasm is, of course, one thing where it happens. Chronic overuse, I think, is where we see a lot of adaptive trigger points form. Our body tends to overuse a muscle over and over and over again, and then our body says that I can't just keep doing this, and I think it decides to just lock a muscle up and form a trigger point.
On the rewind for that, just for the listeners who aren't PTs, could you describe what a trigger point is on the physiological level?
So a trigger point is basically like one piece of your muscle, like a band of your muscle, that is kind of constantly contracting. And they've done some research into kind of why it's doing that. And you basically have one nerve that's just giving a signal to a muscle that just says, keep contracting, hold. And the muscle feels really tight. It's painful. You have spasm. So
we see this. I see this in patients all the time. So,
yeah, absolutely. And what differentiates it? So, people have tight muscles and tight bands in their muscles all the time. What differentiates it as a trigger point is that it's really neurologically active. So if you have a really tight muscle and you roll over that muscle, a trigger point will oftentimes kind of twitch. You'll actually feel the muscle twitch under your fingers when you roll over it. Whereas opposed to a taut band, you just kind of roll over it and it feels tight, but it doesn't have any response. So a trigger point usually is that twitchy, active kind of thing.
Would you say pain is part of that? If you roll over a muscle and it's painful, that's typically means there's a neurological component to it, or?
Absolutely, yeah. So trigger points come in a couple of different varieties. One is an active trigger point where you roll over it, and those are usually pretty painful, right? And you get a little bit of a twitch. There's also something called a latent trigger point, which is where it's not really painful. It can still be a little bit tight, but when you roll over it, you just get that little bit of a twitch. Patient usually doesn't notice it very much. So, yeah.
Okay. So from that neurological standpoint, though, now for the science heads, the introduction of the needle, how does that reset, or what's the process of why the needle is effective for helping with the trigger point?
Yeah. So I'll give the disclaimer before this. Most of what we think about the science is kind of theoretical at this point. Sure. But our best guess right now is the trigger point's kind of neurologically mediated. One place we also see trigger points is when you have a nerve that's irritated, all of the muscles along that nerve will get trigger points. So we think it's a neurological process that causes the trigger point to form and that causes it to relax with the dry needling. So what we think happens, you've got the tight band, you insert the needle into the muscle, and it kind of irritates the nerve or the muscle that's attached to the nerve. That sends a signal to the spinal cord. The spinal cord says, okay, something's weird's going on here, and sends a signal back down to the muscle, and it causes that muscle to relax. So
that's well put and simple.
To back up a little bit, so for people that aren't the science heads and just in terms of dry needling, you're inserting a needle into a muscle. Why do they call it dry? What does dry needling actually mean?
So it's the basics is it's called dry needling because there's no medication, right? So originally when it was being studied, there was this physician, her name was Janet Travell, and she was doing research on cortisone injections. So they used to inject a trigger point with cortisone, and so with any kind of science, you want to have a control group. So they had the wet needling, which was they inject cortisone right into the trigger point, and then you have dry needling where they would just stick the needle in. They'd tell the patient, oh, you're getting an injection, and they'd pull it back out. And what they found in that study is it's like both of them work just as well. So they figured, well, it's working, but one group didn't get the cortisone. It must not be the cortisone, it must be the needle. So they started using filiform needles. Actually, for the people online who can see the video, we have one here. Kind of small. It's in a tube.
Very
thin needle.
Yeah.
Yeah, very flexible too. You can see it kind
Similar
of
to
bends.
acupuncture, would you say?
Similar, yeah. They both use filiform needles, which is it's a thin needle. It doesn't have any hollow space inside to deliver fluids or anything like that. So it's a solid needle. So yeah, it's called a dry needle because there's no medication injected.
And back to the layman listeners, because I know someone out there is thinking it. Could you do the quickest synopsis of how acupuncture and dry needling are different?
Absolutely, yeah. So I actually was just reading an article about this earlier in the week. So if anything, on the surface, it looks very similar. Both use a small filiform needle. I think the biggest difference is kind of the philosophy as to which you're using behind the treatment, right? So an acupuncturist, in some cases, thinks or treats based on energy balancing. Some modern acupuncturists even treat pathology and use very scientific things. And there's a lot of crossover. I read a lot of acupuncture literature just because it seems applicable to dry needling.
For me, a lot of the terms are just semantics of terms.
Yeah.
Chi versus neurological energy moving through the nerve. Like,
yeah. And so, if anything, I think it's more of a semantic or philosophical difference. I would say dry needling is typically performed by an allopathic provider, so typically physical therapists, sometimes physicians, nurse practitioners, and physicians' assistants. I believe in Virginia can get trained as well, but it's pretty uncommon.
Do you need to have a certain level of training? Can somebody at home just take these courses and be able to dry needle?
No. So for the classes, you have to have a degree. So you have to have either a medical degree, a physical therapy degree, physician assistant, or nurse practitioner. Then you have to go and take a series of 2 different classes. So you take your intro level class, and then you practice the needling techniques over a certain amount of time that you learn in the introductory class. And then once you've done so many sessions, I think it's 200 different needling sessions, you can go and take the advanced level class. So for me, and you have to practice for a year before you can take the first class. So,
We have a question from a listener here.
Mm-hmm.
Rebecca says, do the trigger points differ?
Differ. I don't think I know what that means.
Well, I think if I could explain, are there just different kinds of trigger points, or is it?
Yeah. So there's
You said the acute and the
there's
chronic.
the active, which is kind of the more active, painful ones. They're usually twitchier. There's latent trigger points, which are not very active, and they're kind of usually non-painful. They're still there. Sometimes they still feel like a firm spot. Interestingly, sometimes if you needle a latent trigger point, it will become active. And then after it becomes active, it'll go away. And then there's also something called, I find this one really fascinating, a satellite trigger point.
Ooh,
so so between, so you've got a nerve that's irritated, right? So say you've got a nerve in your neck that's irritated, but that nerve controls the muscles in your hand. You can get satellite trigger points in all the muscles in your hand that nerve controls. So,
Well, you were telling me in the past that sometimes you'll needle above and below kind of to get at the nerve a little bit to see if you can get rid of some of those potentially satellite cells maybe? Or?
Oh, absolutely. Yeah. So a lot of times, if a patient comes into me with hand pain or arm pain, leg pain, foot pain, and I think the problem's coming from their spine, sometimes what I'll do is I'll needle the segment of their spine that correlates with those muscles, and then I'll actually needle the trigger points themselves, and sometimes even I'll run an electric current between the 2 of them to help stimulate that nerve and also to help get rid of some of the muscle spasm, things like that.
So Albert, if I'm a listener and I work at a desk and I'm sitting all day and I got just a tight knot or a tight trigger point, I'm not really sure, are there any negative effects of putting a needle into a tight muscle?
Well, obviously, you hopefully have somebody who's trained and does it safely.
Sure.
But say yes, they're trained, does it safely. There's not too many negatives to dry needling. I think the biggest things I see are it makes you a little bit sore afterwards. Sometimes you can get a bruise where the needle goes in. If it's done really poorly, you could have the needle enter somewhere where it's not supposed to go. It could hit a nerve or a lung.
A lung would be bad.
A lung would be bad, yeah. And they've studied kind of the rates of how often that happens. It doesn't happen too often.
Were we automatically thinking pneumothorax, or could it be okay? It's a small needle.
Yeah, so I don't think it would always if it hit your lung, I don't think it would always cause a pneumothorax. Now, I will say I do have some data from a friend of mine who runs dry needling courses, and he did say that in his course of teaching them, there have been 2 incidences in class where it's happened.
And they created pneumothoraxes or not?
They did create a pneumothorax.
What?
Yeah, and so the classes kind of reorganize themselves. They don't teach that technique anymore.
Good idea.
Yeah,
Seems like a smart one.
Advanced level, maybe?
it is. Yeah, they moved it up to like a 3rd level almost class, and it hasn't happened since. And those, I think that's the best place for it to happen, is because that's where you're in training. That's where you'd expect that to happen, not with a live patient.
With someone who's experienced. Infection rates are pretty low, I would assume.
Extremely low. Yeah, I haven't seen much data about it, and I think it's just because it's hard to collect. You can't collect data on something that doesn't happen too much. There's big surgical precautions. So if you just had surgery, they tell you really shouldn't be needling in that window, right?
That doesn't... I mean, that's just better safe than sorry?
Yeah, it's kind of better safe than sorry.
really-
I think the idea is you already have a load of risk of infection after that surgery, so you don't want to introduce another foreign body into the limb.
fair.
I think you probably could in most cases, especially with a healthy person, but I tend not to mess around with it if I don't need to.
Play by the rules.
And, post-surgically, there's so much stuff to work on usually.
course.
That
Those groins after a hip replacement sometimes, though.
adductor muscles, the quad muscles can be really big ones.
Now, do you, as someone who has some experience with dry needling and a accomplished manual therapist, do you believe that there are things that you can get done with the needle that you could not accomplish with manual therapy?
Yeah, absolutely.
Even if you take time out as the factor? Do you believe if you had the time, you could do that with manual therapy, or are there things the needle will get that even if you spend more time, you couldn't get with manual therapy?
Yeah, I don't think there's a lot, but I do think there's a couple of things. So there's a couple of muscles that are kind of really deep in the hip. That I'll tell you, I have a needle. It's let me think. It's 135 millimeters long. I mean, it's about this long, and sometimes I have to put the needle almost all the way down to its handle to get to those hip muscles. And I just think it's so deep that we can dig our elbow into that hip muscle, but I think having a needle that goes that deep can be really helpful. And then there's some muscles in the low back too that I think are just kind of hard to stimulate manually, hard to mobilize manually. So I do think it does give you some options. Now I'll tell you, I used to use needling a ton, and now I'm finding manual therapy skills are getting better. I'm done my residency. I'm doing a lot of classes. I don't need to use it a ton, but I do feel like it's a good option for sometimes it's just nothing else has worked. Let's try needling, and it often does help.
I like it. I do like it, but I do get like a kind of that dirty feeling if someone comes from a clinic and they're like, all we did was dry needling, and that's all we did every time. I'm like,
Yeah, it's not that it's a means to the end, but not an end to the means.
Right.
Yeah.
It seems like it's a kind of a younger man's game in terms of physical therapy.
Well, because it's newer to the field.
Exactly, but there's a lot of, I would say, older therapists that tend to think it's like this new kind of trendy thing. And I think a lot of younger therapists, when they come out and they want to kind of give themselves some value, something that some more experienced clinicians don't have, they say, well, dry needling is something I can get right away, and now all of a sudden I've created some value. But what I've seen a lot of times is, like you said, people just start getting into that mindset of, oh, you got to, trigger point here, trigger point there, let me just start needling.
Yeah.
Can you talk a little bit about any, after you needle, like when somebody comes to you for trigger point dry needling, is that all you do, or is it important to then kind of neuromuscularly re-educate that area or work on posture? I
would almost say I never just needle. And I'll tell a lot of patients that, like, needling is a great modality. I do use it quite a bit. But if that's all I'm doing is needling a patient, I'm probably doing that patient a disservice. I always tell patients there's the trigger point itself, and then there's what caused it. And I could treat the trigger point all day, but if I don't get rid of what caused it, we're not going to get rid of it. It's just going to keep coming back over and over again. So a lot of times, I'll do the needling to get some range of motion or to get some pain relief, and then I always follow it up with, so I do a lot of PNF through my residency. I followed up with a lot of PNF. I do a lot of exercises to help stimulate whatever muscle, either that muscle itself or the muscle that it was kind of compensating for. Do a lot of postural education, sleep education. Sometimes too, even if it's that more acute patient where they have a good mechanism, they maybe like strained a muscle and they've got a trigger point. I'll just put them on some kind of aerobic exercise to get some blood pumping.
I think Q's bringing us into some of those referral pain patterns that we were getting too.
He said, as one has a better understanding of referral patterns, treatment of more proximal musculature can diminish distal pain. an example of needling an infraspinatus, one of the muscles of the rotator cuff, with patients complaining of wrist pain.
Yeah, absolutely. So infraspinatus has, and so for our non-PT listeners, that's a shoulder muscle. It's one of the muscles in your rotator cuff. Has a really interesting pain pattern. So a lot of people will feel it in kind of the area between their pointer finger and their thumb, or sometimes into their wrist, sometimes in the back of their arm, where their triceps is. So yeah, referred pain is a really tricky thing. Almost all trigger points have some kind of referral pattern. So if you push on it, it's kind of one way to confirm a trigger point too. You'll push on it. You won't just feel pain there. You'll usually feel pain radiating to another area, typically away from the body, right? So, or away from the heart is kind of the way to think about it. So if I push on my shoulder, typically it's going to go down my arm. It's rare for it to like push on my thumb and I feel it in my neck. There's a couple exceptions there, but most of the time it kind of refers away from the body, and that's how you can really confer that you're into a trigger point. Yeah, absolutely. But back to what your listener was saying, a lot of times, if that was my patient, and I was thinking, oh man, it's their infraspinatus, I'm probably going to check their C5 vertebrae in their neck too, to see if that's irritated. I find a lot of people with chronic shoulder issues and things like that, I need to look not just at the shoulder muscle that's causing the wrist pain, but the nerve in the neck that might be causing the shoulder pain, their posture, how their shoulder blade sits on the rib cage. So,
yeah, I think that's an important part of everything. You got to have a good assessment and evaluate everything before just sticking needles in it, before doing any treatment, you know?
Absolutely.
The wrist bone's connected to the elbow bone's connected to the shoulder bone. We're all one piece.
Exactly.
Great.
Yeah.
Okay, so if anyone has more dry needling questions, we've got a close access line to Albert, and just go ahead and email them on in. We can get those questions answered for you.
Absolutely.
All right, good.
Great, excellent.
All right, you want to move on?
So we're moving on to some sport questions. We're going to let Albert hang around for this and see what his sport knowledge is.
It's pretty bad. I'm not going to lie, but I'm going to try my best to keep up here. So we'll see. We'll see what I have to contribute. I may just awkwardly walk away at some point if I just am not contributing at all. But
however you feel comfortable. Dunk contest, big controversy.
Yeah.
What'd you think?
I thought Aaron Gordon should have won.
I'm not going to disagree with you on that, but I just didn't think the big dunk, the going over Taco, was that. Like, I think the media hypes it up because they're told to hype it up. It looked like he jumped on a tall guy's shoulders, launched himself off of it, and dunked it.
Half of a dunk contest, though, is getting the crowd involved, right? It's a very subjective...
And I think Aaron Gordon gets a lot of credit for being the most... what's the word I'm looking for?
Innovative.
Innovative, thank you. Yes,
Yeah, he comes up with
these
things.
novel ideas. It's not the same Jordan dunk from the free throw line every time. So I think he deserves credit for that. They should have split this one.
It is interesting, though, because on one of his dunks, the one I think he grabbed it and went between the legs,
Yeah.
the announcer did say that's the same dunk. So in this dunk contest, granted, he had to dunk a lot more than most dunk contests.
Dunk contests will go on for the rest of time. There's only so many dunks.
Yeah.
so, as somebody who doesn't know a lot, you're making it sound like there's actually rules to a dunk contest.
Oh, yeah.
Yeah.
And the part of the NBA All-Stars that it's been losing viewers consistently every year, so they're always tinkering around with something. Like this year, they're changing. You want to go on the rules? How they did not follow the rules according to what
Yeah,
you're
it's
reading?
confusing. Apparently, the judges were supposed to just make a final vote after the dunk off.
Like if they tie after the 3 rounds.
and they did the points overall or something. So yeah, they didn't do it correctly. But
So they ended up doing a dunk off, which I don't believe we've ever seen before. Or at least I can remember
I
seeing
can't
before.
remember. It changes every year.
So yeah. So now they're basically each doing one dunk, and you have 5 judges rating from a 0 to 10 on the score.
Yeah.
And one person wins.
I think it'd be interesting. They measure the winner of a dunk contest by who produces the highest decibel of cheering in the stadium. Right? So
that would be good.
it's somewhat less it's very objective. You know,
I
you
think
say
if
this
that was the
person-
case, then Gordon definitely would have won. It was awkward seeing Jones, right? Jones won. That's his
Derek
name?
Jones, yeah.
Derek Jones take the trophy because like he kind of felt like awkward, and like the crowd, like I thought they might boo.
Well, so I think it's also part of like Derek Jones had to go first, right? So Aaron Gordon kind of sees what he needs to beat, pumps the crowd up. Everybody's saying it's going crazy. He jumped over a 7'6" man.
Jumped up without the head. It's like 7 feet.
But he went down, but he kept the ball there. So the
Okay.
ball is now his head.
Okay.
But he did grab it.
So he took off a 7'6" man's head, but he pushed off too. Watch it. He pushes off.
I didn't think so. What are you saying he pushed off? When he grabbed the ball, he pushed down a little bit?
Yeah. A lot of it.
Yeah, I don't know.
I don't know. I was on the eye test. To me, I was like, really tall guy. It sounds cool, but it didn't look that cool to me. I don't know.
Well, with the
It's not a travesty that he didn't win to me.
so Derek Jones went first. He did like a windmill from just inside the free throw line.
Right.
And people were like, it looked easy, which is part of the problem.
And it's not novel. It's not innovative.
Well, a
feel like
windmill
it's-
from inside?
I think
Michael
I've
Jordan
seen
did
it.
the kind of air.
I know that was 1985, though. I think I've seen like windmill type things from the line. I can't remember specifics, but I feel like it's
All right, I thought it looked good.
It
They-
looked-
they
no,
were
I
saying
agree.
everybody was saying that was going to get a 50.
right. So that
for him to
that
get
on the eye
48
test, that on the eye test for me did better. I thought it was just aesthetically, it was like a Manny Ramirez swing. It was just nice looking.
Yeah, that's
Like
important.
yeah.
But you also want to see somebody like really struggle, like, oh, he just barely with his outstretched hands, like that
Gave
was
it all.
so hard. And their players these days are just making it look too easy.
Yeah.
Like I think if they watch us dunk and just do a regular one-handed dunk, it would look more impressive just because of how difficult it looked. Like, man,
Yeah.
that must have been tough.
There was this theory in the I forget where I saw this, probably on the internet somewhere, that the Olympics, and maybe the dunk contest can include this too, should include one regular person for reference.
To make it, yeah,
I saw
right.
that for the Olympics. Where did we see
They
that?
did that with
Where
the
did you-
running.
Yeah,
the
right. You
speeds
have
of each-
sprinters. You just have like, get me out there. I'm pretty average. Well, no, I might be worse than average.
Bobsled man. I
Bobsled-
want one
yeah.
average bobsled.
You just
team.
have like a really average person in the dunk contest, and that way people have a reference to how difficult that stuff
would be
actually
awesome.
is.
I think it's a good idea.
Yeah.
Yeah.
Although, could you imagine being that person? Like, what's your job? I'm the reference person.
But for dunk contests, it's hard because there are a lot of people. The majority of people, but 99.9% cannot dunk. I can't dunk anymore. Can you?
So maybe they
you still
show
dunk?
like the
you throw it
vert.
down? Can you throw it down right now?
What are we throwing down? Basketballs?
Even a tennis ball.
I could get a tennis ball down.
I can't. Not anymore. I'd like to try. It'd be fun to see.
Can you get net?
Yeah. Oh yeah. That's like a foot.
Can you get the rim?
Can I get the
I'm
rim?
taller
No.
than both
I don't think I get the net at this point.
I think
let alone the
I
rim.
get plenty of net. I think the rim's a stretch for me.
Now, I will say I used to be able to get the rim, but I do think it was youth league, so I think it was lower to the ground.
6 foot rim.
It's different, right? It's different heights depending on how old you are when you play.
Oh yes, correct.
Yeah.
Little nets. And the All-Star game.
Exciting,
Yeah, good game.
incredible.
Good game.
It was the best All-Star game I've seen in a long time.
Yeah, I didn't watch it.
You missed out. That last, technically it's not a quarter because it was untimed.
Yep.
But for them to go to a certain amount of points, it was exciting. Giannis blocked LeBron. Like people
exciting.
are playing legit defense, and people are also, when you get fouled, people are getting in the ref's faces. Like they do not want to lose.
They play defense?
They played a great defense.
Really?
The last like 15 points was like actually watching like a street ball game. It was almost as if like, hey, we put $100 on this game. We're playing street ball and we got $100. It would have been better if there were no refs. Call your own fouls.
I'm for those rules. Those are good rules.
But then you got guys like it just styles. Like James Harden's going to call a foul every single 3-pointer he shoots.
I saw James Harden passing a little bit.
That was the other kind of controversy. So the fans vote in the starters for the All-Star game, and then they have captains. So LeBron James and Giannis Antetokounmpo, whatever. So they then select teams as if it's dodgeball. Hey, I got Albert. You take Mark, and they pick players.
Yeah.
But once the game starts, it's really the coach's decision who plays. So Harden wasn't really doing much for most of the game. A lot of people said he should not have been out there at the end of the game. Same thing with Kyle Lowry. Put Trae Young back in. Put some of the starters. Harden was a starter. But, maybe Chris Paul or,
So you're a fan.
it was great. It was great basketball.
Okay.
LeBron struggled in the fourth.
Kawhi won MVP.
He did, deservedly so.
Good. Best
was-
player in the NBA? Maybe.
Maybe.
Giannis
still looked incredible. I think he was the best player in the thing. But we both did. But you went on a tangent last episode,
Right.
Saying about how Giannis lost all but I think 2 of we
Correct,
compared
yeah.
players by which rounds they were picked.
Apparently, it's clear that for every one you lose a point. They lost by 2. No, I think it speaks to the best players don't make the best team. I think Giannis in his draft was trying to draft a team that would play well together. And they did, but they still lost to the better athletes.
Giannis's team played harder for the majority of the entire game.
I believe that.
LeBron's was going more on talent.
Yep. Makes sense.
Kyle Lowry took 2 offensive charges in an All-Star game at the end of the game.
That's great. That's what people want to see.
LeBron going full force, and he takes a charge. He steps in there and takes a charge.
Well, they were playing for more this time, right? I think there was charity on the line. I think the winners got more given to their charities of choice or something.
Okay.
Charity is always a good thing to play for because you're not being selfish. You're not saying, "Oh, we're playing for an extra $1 million each." The kids with cancer, they're going to get help if I take a charge. I'll take the charge.
So you're saying that if an NBA player, if they're going to play harder to give to a charity than to receive money themselves?
In the public image, for sure. I don't know what their actual motives are, but on the image of it, that's what they want to look good for sure. You would do the same thing. You know you would. I would.
If you
You would
podcast,
play harder for the charity.
Yeah, you got it. Come on. You're going to say, "Oh, I'm not going to play for the charity"?
I'm going to play hard regardless, Mark.
No, harder for charity.
Okay.
Kids matter.
would you treat harder
For
to treat
charity.
a patient for
Yeah.
charity?
Yes.
Do you treat for charity?
Yeah. Throw a pro bono in there. Well, maybe they help you with the dishes or something, but
Wait, what? Where are there dishes in this clinic?
I don't know.
Doesn't seem sanitary.
People have to eat. People have to eat.
But overall, I think the people were saying the dunk contest reminded them of Michael Jordan and Dominique Wilkins.
That's a lot to say.
Considered the best one of all time.
I can't agree.
And then people I was talking to about the All-Star game, so this is the best one that they can remember.
I'm
I will watch the All-Star game next year.
I'm going to watch it tonight. I'll find it online somewhere. I'll let you know what I think.
Aaron Gordon says he's no longer going to participate in the dunk contest. I don't blame him.
Yeah.
Should have won
If it-
twice, in his opinion. And
I
a
mean,
lot of people's
If
opinion.
at first you don't succeed, quit. That should be everybody's motto, right?
Yeah. It does beg the question, is he the best dunker to have participated in and not to have won a...
Probably, right? I mean, that's just fair to say.
I don't, Dominique Wilkins never won one, right?
Dominique Wilkins never won one.
I don't believe... Don't quote me on that, but I don't believe
We
he
were
did.
going to have to fact check that because that would surprise me. I was too young. I can't remember him. I mean, I've seen the highlights. I just assumed he won one.
Does it bother you that guys like Zion's not in it this year? Blake Griffin's no longer in it.
Yeah. What's the deal? Why not? You're afraid of something? Zion? Listening, Zion? Calling you out. Get in there.
Yeah. Derek Jones, I think, is one of the best.
LeBron's never
Freak
done
dunkers
one.
in there.
LeBron never done it.
Yeah.
Dwight Howard's doing one at age 49. Why can't LeBron get in there at 36?
Dwight Howard, they were saying the only bad dunk of the
Well, I
show
mean,
was Dwight Howard.
He's 58 years old. What do you
He
want?
did a Kobe. I mean, he took off the... Did you see that?
I did, yeah.
Yeah.
Did the Kobe and the cape and
Yeah.
I don't know.
Took off
He's
this S and it was a 24.
67 years old. What do you want from the guy?
He's gotten older every time you said his age.
He does BFR. He's the main
Does.
proponent for BFR.
Interesting.
So if BFR gets you doing the dunk contest at age 84, I think that we should do it with all the patients.
See, that's why I think that's why they need the reference person, because then he's definitely going to be the worst.
Right.
I think the NFL or NBA players would pay for the reference guy just to be. You would be sure you were not going to be the worst guy in the dunk contest because you got Larry. Larry seems like the guy's name. Probably should be Larry. If
I
he's
know
the
a Larry,
reference
and
guy.
he looks like a
Do
reference
you?
guy. Larry is a reference type name.
It's pretty standard.
All like 50-year-old guys' names that don't get used anymore, like Larry,
Yeah.
Phil, not a lot of
Phil.
Phils.
My uncle's
Frank,
Phil.
Bruce,
Bruce.
Lance.
Also, all very weird names for a dog.
Yep.
Yeah.
Can you catch us up on where Maryland's standing and what's going on in NCAA in general?
Yeah, of course.
Catch me up.
So nothing's really changing in the top 5 teams.
Why?
Well, you got Baylor at number 1.
Yep.
Their record and like their strength of schedule, who they've beaten, their resume is incredible. So they could actually lose a game. I'm not sure they would drop out of number 1. If they had like played a ranked team and lost, they may still stay at number 1. Definitely still going to be a 1 seed.
Yeah.
You got Gonzaga, who probably not going to change because they're, in the conference out there in the West. And
They don't play anybody.
They don't really play anybody. So they're going to play maybe another St. Mary's in the conference tournament, but they're not expected to lose anytime soon.
St. Mary's can be a challenge. They almost beat them every year.
But they're also in the same boat where they don't play anybody else, so they get a great record and they're ranked high, or end up getting kind of on the fringe. You got San Diego State, hasn't beaten anybody,
But
but they haven't lost.
they haven't lost.
They haven't beaten a ranked team, but they're probably not going to lose.
Okay.
And then you've got Kansas.
Kansas is good.
Kansas is good. They probably, I would imagine, they will lose at some point in the conference tournament.
Can't win them all.
Can't win them all. They may drop out of it. If Gonzaga loses, they're coming out of the 1 seed. 2 seeds are rising.
Yep.
So you've got Dayton still there.
Dayton Flyers, 5 seed. Obi Toppin, coming on strong. Beat UMass this week.
Would you ask me if they're deserving of a 5 seed? No, I would put Maryland and Duke both ahead of them.
2 losses.
In what, the A10?
Yeah, but they only lost to Kansas and I forgot who else they lost to.
It was
VCU, maybe?
No, it was Colorado.
Okay, so they haven't lost in the A10.
Also, have not beaten a ranked team.
Well, I mean, you play in the A10. What do you want?
They've got decent wins, like Rhode Island. They've got quadrant 1,
Rhode Island's
quadrant
good.
2 wins.
Fats
They
Russell.
haven't beaten anybody.
Okay.
So I would say Dayton, at this point now, with the schedules that Duke and Maryland have to play, they'll probably, if they don't lose Maryland or Duke, they're going to jump ahead of Dayton.
I want your Final Four right now. What do you got? Final Four.
Well, it all depends on how the
I know,
brackets shake out.
but I know if they're not if they shake out the way you think that the top 4 teams all make the Final Four, what do you got?
I'll put Baylor up there. Their resume is strong. They've beaten teams. They've shown that they can play hard. They're
Okay.
actually playing without
All
some
right.
of their star players. I'm going to put Maryland in there.
Maryland. Probably a 2 seed right now if it were to happen.
Probably a 2 seed. If they win out and win the Big Ten tournament, they're going to
get
be 1
in.
seed.
Yeah, they're going to get in there.
There's teams that just we need to see the conference tournament.
Okay. Next, 2 weeks?
4 games left on most people's schedule. Then we get the conference tournament.
Dude, things are heating up again. We said we were in the lull of sports for the year, and we're feeling the fire. It's coming back.
So Michigan State, preseason ranked number 1.
Yeah.
They're dropping out of the standings. They're 26 this week, right?
Yeah, they keep losing.
They got a big game at home versus Maryland.
Yep.
Maryland hasn't won at Michigan State since 2014.
I didn't know that.
Okay? Maryland goes off to a 12-point lead at half. They're winning. They're dominating the game. Second half, different story. Maryland doesn't look as good. Michigan State goes on these runs. Finally take the lead with like 7 minutes to go. With 3 minutes to go, Michigan State's up 7. The crowd is going crazy. Maryland's in a drought. Call timeout. 14-0 run to end the game.
Booyah.
Maryland wins.
Booyah.
The mental toughness that this team has and just the ability that they expect to win and that they're continuing to pull this off with senior leadership, Anthony Cowan. They got a round 1 draft pick, Jalen Smith. Their role players starting to go.
You know they're calling him Thicks now, not Sticks. Thicks.
He's pretty muscular. He still gets pushed around a little bit. Xavier Tillman, his wife is getting induced. This is a college kid. Wife getting induced for their second child the day after the game.
It's a good idea.
How do you play with that? That on your mind?
It's not the first kid. It's the
She's
second
in
one.
the stadium.
They already did it once.
She should not be in that stadium. That crowd was rocking. They're going to induce it in the stands.
Is there a doctor in the stands?
Complete side note: didn't one of the Nats players miss the birth of their child because of the World Series?
We talked about
Opposite.
that.
They went to.
They went to the birth of
It was a
child.
relief pitcher.
Oh, really?
Was it Daniel Hudson?
That sounds right.
I think it was Daniel Hudson. He chose to go be with his wife, and a lot of fans were saying that he's not invested in the team, or he got a lot of negative publicity for going.
Really? I thought it was the exact opposite way around. I thought he was like, yeah, I'm playing the World Series. Forget about my wife.
What would you have done?
I'd say most athletes go.
See, not very invested in baseball. So if you ask me, what would I rather do? Play a baseball game, the most important baseball game ever of my career, or be with my wife? I'd be with my wife. But if you ask me, I don't know, ask me something.
You're asked to present at the national conclave, all these things, something you've really dreamed of doing. Get your name out there, but it happens to fall on the same day your wife's going to be induced.
Yeah, but it's a
What do you do?
presentation. You could just say, I'm going to do it next year, guys.
But there's no-
It's not like sports.
Yeah, you could say World Series. I'm going to
Says
play in
the
it next
day
year.
she's induced, could I just do the presentation and then rush back?
Yes. Presentations don't work. What would you do, William?
Happy wife, happy life.
What,
I'm with
what if
Will.
it's the Super Bowl?
100% with Will.
Happy wife, happy life.
Yeah.
Super Bowl?
I think what you're making a good point. I think if you ask most players, what do? They will take Daniel Hudson's side. If you ask fans, who really, we say we're invested, but we're not part of the team,
The World Series can be 7 games. The Super Bowl is 1 game. I don't know. One game.
Yeah. Well, we see what you're choosing.
I'm not.
Says the man without a wife.
I'm with you guys, but I'm just
Should
saying
we-
it's a stressful decision.
Should we inform his girlfriend?
She'll be like,
Inform his girlfriend.
yes.
Yeah.
Yeah, she's listening.
Okay, good.
All right, you wanted to talk. You're very excited about the NFL Combine.
Defender. And XFL first. DC Defenders are in first place.
One pause. My wife is apparently watching this.
Good.
And she said, "You darn well better be with me." So, yeah.
Even if it's your second.
She didn't say second.
She didn't talk about the second, so I'll get a text here in a couple minutes.
DC Defenders are in first place.
First place, Cardale Jones ripping it up. Best probably MVP of the league right now. Will, are you interested in the XFL?
Not yet.
No?
What was the final score of this game? Do you remember?
It's like 27-0.
0. Mark, the XFL is supposed to be entertaining.
So this is
0 points.
So
in
Matt-
a game designed for offense.
At
0 points.
halftime, Matt McGloin said that Kevin Gilbride will have to change the offensive playbook because nothing's working. And they asked Gilbride about it, and he said, "I've never heard a player say that. He needs to play a lot better." So,
Can you talk about? I did watch actually a couple minutes of a game that happened to be on. Josh Johnson. He was with the Buccaneers
Detroit
last year. He was on he started on a team last year.
I think he was with Detroit.
So he started for
Somebody
on the XFL
Yep.
last year, but he didn't start week 1.
Nope.
So I'm wondering, does the XFL have a lot of a pretty short leash in terms of you have a bad game, you're
I just don't
putting
think
in
that
somebody
they
else?
figured it out yet. I feel like these teams have been together for such a short period of time. Aaron Murray has an injury right now. Great player, quarterback at Georgia.
Georgia, yeah.
Yeah, he got pulled too. Well, they're saying it's an injury, but it seems like he kind of got pulled. He's the Tampa quarterback.
I wonder how much of it has to do with the whole salary factor of nobody's really making, everybody's making relatively
I just
the same
don't think
money.
that, I just don't that from the pool, the teams have been together for such a short period of time. I don't think they know the answers yet, but they do know Cardale Jones leading DC to their first championship in like 8 months.
What Dallas as a team,
Yeah,
how are they doing? I know they lost their first game.
I think they're 1-1. Really been following DC.
All right.
Kind of exciting. Yes. Don't forget NFL Combine coming next week. I saw Sam Fierro, very excited about the Combine as well. You guys thought it was crazy to talk about it. NFL Combine next week. Let's see how fast these kids are.
So what are you excited to? Who are you excited to see?
Jalen Regar out of TCU Horned Frogs. I think he's
What
going
position?
wide receiver.
And what are you looking for?
I'm
40?
Yeah.
Another. That would be great to have references of just the average,
100%.
even the
They
average
do it.
college player.
They do it. They do it. Every year, Rich Eisen runs the 40. He does. Do you know Rich? As everybody know Rich Eisen, sportscaster? He's good.
Oh.
He's good for around. He's about 50, and he runs it in his suit. And on his podcast, it's his fly tying back running the 40. He's good for about a 6.
I vaguely remember last year seeing them have actual people running, have them kind of side by side from years past. Like Joe Flacco, I think, was being compared to somebody that ran at this time.
That's computerized in.
I'm aware.
Okay, just making sure Joe Flacco's not getting out there and running it again. Yeah,
How old's Joe Flacco?
Huh?
How old's Joe?
he's not that old. He's just
still
not
a
good.
Starting quarterback right now, right?
No,
Who's starting in Denver next
I
year?
would say Drew Lock.
Okay, that's not a lock.
It's getting close to a lock.
Okay, go
He
on.
took his job this year.
It's computerized for all the people who are.
Yeah, so it's fun to watch. Rieger could go sub 4.3.
So say he goes sub 4.3. Has that improve his draft stock?
It does. It's not smart. It's not. I'll tell you, it's not smart. This is the Al Davis way of drafting. The amount of players who've ever run under 4.3. I think since we've been doing laser times, which started in 2008, only one of them has ever been good. They're all busts. Their draft stock goes way up. He'll get drafted probably in the top 15 if he runs sub 4.3. But Chris Johnson's the only one to ever do it and be successful in the NFL.
What are your thoughts on this Rieger guy? Right,
Yeah.
runs a 4.33,
Okay. That's probably what he should run. So if he's better than that, we're excited.
4.3 flat. Okay.
Yeah.
Compared to he just says I'm not doing the combine. People estimate I'll be around
Yeah.
4.33.
Yeah.
But I don't want to do it. I'm not hurt. I just don't want to do it.
Yeah, they're going
How
to
does
say
that change
they'll
the
say
draft
they'll
stock?
say it doesn't make a difference. We're going off the film. We just want to confirm it, but it's always a lie. Someone runs fast and their stock goes way up. Yeah, it takes him from a borderline first rounder to a top 15 if he runs under 4.3. Yep, that's it.
That's all you got.
That's all. I mean, that's the
You
one
were
I'm
so
excited.
excited to talk about One player.
Well, we could talk more. I mean, he's just the one I think that's going to run the fastest. There's still more to come. We're going to see what everybody else has got.
You know who's really good at getting players drafted based on combine?
Who?
Maryland.
Yes.
Darius Hayward-Bay went like 8th overall because he ran a really fast 40.
Do you know what he ran?
4.35.
I almost cursed because I was so surprised you didn't know this. He was under 4.3. He's a 4.27 guy. Yeah, bust.
Raiders took him.
Yep.
I believe 8th pick.
Al Davis. There you
You
go.
know who they got as their quarterback?
That year?
Not a Maryland guy, but yeah. I don't know if it was that year.
Mark Tuiasosopo?
I think they got him the year before.
Mark Tuiasosopo.
Jamarcus Russell.
He
He could throw it the furthest.
Yes.
How does that not work? You got the guy who could throw it the furthest and the person who's fastest.
Nope.
They
never
were
works.
horrible.
Nope.
Both, but I would, for number 8 pick, Hayward-Bay was a bust. He
Huge
stayed in the
bust.
league for a while.
I just said anyone who runs under 4.3 besides Chris Johnson has been a bust since we've been doing laser times.
Ross has shown signs of hope recently. John Ross.
No, he hasn't.
What do you mean?
Where did you-
He had a
what-
couple big games, and then he got hurt again.
What are you talking about? He had one, like, what did he catch
He
a
was
touchdown?
a fantasy waiver pickup.
Yeah, and what did he do? So what did John Ross do in college?
He
don't
ran
remember.
fast and caught the ball.
And got hurt.
Yeah, he's a twig.
So I mean, that's what he does in the NFL.
You call Reggie Bush a bust? Reggie Bush.
Reggie Bush was a bust. Yeah, he's the 3rd pick overall. Will
He had great years.
he?
What do you want? What
for the 3rd pick overall? You
do
should
you want for a running back?
for a 3rd pick overall. You should have multiple 1,000-yard rushing years. You should be in multiple Pro Bowls, in the conversation for MVP at times. Reggie Bush rushed for over 1,000 yards one time. He's a great. It just stinks that he was drafted 3rd. If he was a 2nd-round pick, then he looks great. One of the greatest college players of all time. One of my highest NFL draft grades that I'm admitting I was wrong on. He's the highest player I've ever graded. I think. Not an awesome player. That's what the excitement of the combine is. We're gonna see. We get to form our opinions.
But we all agree.
Tua is supposed to do something. I don't know what he's supposed to do, but he's supposed to do something.
This is the guy that broke everything, like his whole leg,
Well, he dislocated
Yeah,
and had
tightrope surgery.
a fracture of his acetabulum. Yes.
after having the tightrope in his ankle.
Correct. He's supposed to. I think he's going to throw a ball or something.
That would be impressive. Potentially a number 1 pick's going to throw a football.
He's not going to be number 1 pick. It's Burrow.
People are talking about Tua moving up though to be top 5 pick.
Yes. Miami.
I think that's crazy.
I think if his medicals check out, it's going to be next week. We get the medicals on him. If his medicals check out, I think he could be the 2nd pick overall.
To me, that would be the
I would.
biggest bust potential of any
I think
quarterback.
I think really on the talent, it's all there. But I think, like I just said with John Ross, you get hurt in your NFL career. We're looking at your college window to tell us what happens. He's been hurt throughout his college career, and not just his major injury. He's had multiple ankle injuries. He had a shoulder injury too.
Yeah, I'm with you. I think he's
So I'm just
a
I
great
think
player that's going to get hurt.
I don't like saying it, but I'd be worried enough as a GM to say, you know what's the funny thing? If I was the GM, I wouldn't want to have to make the call. I'd want to like not be in the situation. But if I was the coach and the GM drafted him 2nd overall for me, I'd be like, all right, well, he's a great player. If it works out, it works out. But I don't want the heat if I'm wrong.
If I'm a team and I need a quarterback, that's my number 1 need, and I have a top pick, even with Burrow, honestly, I'm probably trading my pick this year.
You'd trade out for Cincinnati?
If I was Cincinnati, I would trade out.
I would take Burrow, but the question is, Burrow has said he might not want to be in Cincinnati, which leads to possible trade out. There's no
I feel like
guarantees.
next year there's the better draft.
Yeah, we say that every
quarterbacks coming.
year, though. We do say that a lot. If this time last year we
Trevor
were.
Lawrence, I will go out on a limb and say Trevor Lawrence. Not even going out on a limb.
Yeah.
I think most people would agree.
Yes,
Trevor Lawrence
most people
is better.
agree. But I'm just saying, just what
Justin Fields will be
give
better
me-
than any quarterback in this.
Yes,
draft.
I agree. But just in retrospect, if we were sitting in these 2 chairs last year saying the same thing, we'd be saying the same thing. Hold off for next year. You're going to get Tuiasosopo and you're going to get Jake Fromm. And Jake
I
Fromm
don't
had a
think
terrible
it's
year.
Osiopo. Taglia.
Oh, sorry. Tuiasosopo was the old Raiders guy I was thinking of. Yeah, Tagliavola. We would have been saying the same thing last year. So a lot happens in a year.
And who were the quarterbacks?
Tagliavola.
And who were the quarterbacks that came out last year?
Daniel Jones, who was an overdraft. Dwayne Haskins, who hasn't looked good. Drew Lock.
So we're right. Hold out to this year.
Jake Fromm's
Hold
not
out
even,
again.
Jake Fromm's not even going to be a first-round pick this year.
Yeah, I don't want Jake Fromm.
If Justin Herbert came out last year, he would have been drafted off before all those guys. Now they're saying he struggled under pressure this year.
Yeah.
So maybe we'll see. I agree.
Lawrence
Lawrence is
Fields.
the guy. Agreed. But a lot happens in a year. That's all I'm saying.
Yeah, if you're the Bengals, the problem is there's such a need to win now.
Joe Burrow's a winner. I mean, you can't argue with pedigree. I don't know.
He got passed up by 3 teams, right?
No. What are you talking about? 3 teams. He lost his job to Haskins at Ohio State, and Haskins was throwing perfectly.
He sat out at LSU, right? Also, he was behind quarterbacks at LSU.
I don't think so. Well,
How many years has he been at LSU?
2. But he had to sit. I
He
think
started both.
Yeah, but he had a better year the second.
Is that true?
I don't think he's ever lost a game in his life.
But he's been beaten out in quarterback. Multiple coaches have said that we have a player that is better than you.
That as
For you to be a number one pick,
that only
I don't
happened
like that.
that only happened with Haskins, and it's because Haskins has a better arm than him. That they said it. That's why. I'd take Burrow.
I don't like it.
Yeah, Trevor Lawrence dislocates his knee next year, and then we're sitting here and we're like, well, man, if we took Burrow last year, I mean, things happen. You got to go with what's in front of you. I take Burrow. Okay, enough. I agree to disagree.
All right.
Whenever I start talking with like a patient in the clinic about like video games or something, and you both just look totally confused, I get that now. Like I have no idea what just happened. Now, okay, let me see if I can remember the combine. And I don't think I've ever watched one of these. Bench press, squat.
No squat.
No squat.
Bench press.
Bench press. There's your
40-yard dash.
40-yard dash. There's a high jump.
Vertical leap.
Vertical leap. How long can you throw a football?
That's not measured. They look at that, but that's not measured. You got a 3-cone drill. You got a 20-yard shuttle, a 60-yard shuttle.
Okay.
I think that and then the drills. Am I missing one?
I think it's all of them.
I think that's all of them. Yeah. Those are the measurements, and then all body part measurements too.
Should we do a Will and Mark's Healthy Sports Obsession combine and just see
Yes.
how well we do?
Okay,
And then we'll also post what injuries we sustain while doing it.
sounds good. Dislocated hip with fractured acetabulum would probably be mine.
Yeah, that sounds like that. And what was that player's name again?
Tagliavoloa.
I think he has mispronounced that every single time.
Okay, all right. That covers us for sports. Again, we got Albert here answering dry needling questions. You can send your emails into Will and Mark's HSO or get us on Facebook. Just post to the Facebook and we'll answer those questions for you. Get pumped for the combine. All right.
Over and out.
Over and out.